Tell us a little bit about yourself.
My name is Ellie and I'm 15. I like to swim and I like to play the piano. I was 10 or 11 and I remember we just went in for a checkup and she said, can I have you bend over for me because I'm noticing something, and she had me bend over and she said, the nurse said, it looks like you might have a slight curve. And she sent us to Gillette and they said that I have scoliosis and that it could possibly be fixed with a back brace, and so they put me in one and I wore the back brace probably for 3 to 4 years.
What concerns did you have when you thought about surgery?
My biggest worries about having surgery was what it would feel like when I woke up and what it would be like going to sleep and like the pain I would be in. And I was also, I'm gonna be honest, I was worried about if I'd feel sick when I woke up.
What do you remember about your surgery experience?
I had to shower the evening before and then the morning with some special shampoo and some special body wash so that my back would get clean. And then we drove to the hospital. I remember it was really weird. It felt really weird when we got there because it was really early in the morning, so not many people were there yet. So it was just kind of dark inside, but we walked through and we went upstairs and they did an x-ray of my back. And then when we got back to where my family was waiting, they took me back, and then a couple of people in my family got to come back with me, and they did my height and my weight. And then a couple of nurses came in. One of them, the anesthesiologist, put the IV in my arm, and then another nurse checked my lungs, which is how we found out that I had 50% of lung capacity. And then I remember they gave me a pill to help me because I was really anxious. And that's the very last thing I remember before I went to sleep. I don't remember a lot of it, but I remember opening my eyes and looking around and seeing my family around me. And I remember that first day, all I could eat was ice chips. I remember that I didn't get a lot of sleep because I was in a lot of pain. I had nurses in and out giving me meds. And I remember I had a nurse's button on the side of my bed so that I could press it if I needed help. And I constantly had to be turned, like during the night, I'd constantly have to be turned on my side and then on my back. And I was always adjusting my bed.
What were some of the things you did to prepare to go home from the hospital?
I had to walk the unit, walk circles around, and I had to go up and down the stairs multiple times. And then I had to take a shower before I left, which was really, really uncomfortable. I sat the whole time, but it was just really uncomfortable, and I felt dizzy and I felt nauseous, kind of like how I felt when I woke up. I had a catheter, and then I remember I also had a drain tube. I remember when they pulled it out.
What did that feel like?
I don't know, it doesn't really feel like anything. And same with when they took out the catheter. Just didn't really feel like anything.
What was it like when you got home?
I remember getting in the car and going home. It was not a very good car ride. That every little bump I would hit would make me uncomfortable. It kind of hurt. So it just wasn't a very good car ride. And then remember when we got home, we had somebody there to help me get up the stairs with my mom. I laid in bed for the first 2 weeks. And we had a lot of family in and out bringing dinners and just coming to hang out with me.
What helped you cope with that initial discomfort?
I had a lot of pillows and I had a special wedge pillow that would help me be able to sit up and still be comfortable. Whenever I was in pain, even like in the middle of the night or just anytime, I would get up and I would walk the hallway upstairs in my house, just go back and forth until I was able to get down the stairs and I could walk outside. When I had to take a shower, I had a chair inside the shower where I could sit and take a shower so I could be comfortable. And the shower helped with my pain. If I was in a lot of pain, I would ask if I could take a shower, and then just being in the warm and the steamy would help.
What is your life like now?
Now that my spine is off my lung, I can go on longer walks without getting really tired and breathing really heavy. And I used to have a lot of side aches even when I would just walk, but it's gotten better.
Do you have advice for someone who's thinking about spine surgery?
I would say go for it, and people are going to be there to help you, and it'll be good.